One of the main reasons Jamaican overseas said they're not moving back to Jamaica is healthcare. The other one is crime. And both of these issues get the same treatment. People hear things overseas and they use it to measure whether it's safe to return or you can get healthcare. And today I want to take a look at healthcare because healthcare is getting a bad name outside of Jamaica that it does not deserve, right? We tend to compare Jamaica's healthcare system to an imaginary version of healthcare somewhere else. But let's get real. The US has world-class hospitals and world-class healthcare, but yet you still have people unable to access healthcare when they need it. People dying from diseases that they don't need to. And you also have people who are going bankrupt because of medical care, right? Because they're either uninsured or underinsured or not insured at all. In the UK, where they have the NHS, people still wait months for care. Canada has universal health care and people still face delays. Every system has strengths and weaknesses, not just Jamaica. Hi, my name is Claudette and I am your Jamaican Gypsy Granny. If you're new to the channel, welcome. And if you've been here before, welcome back. So the questions we should be asking ourselves is what healthcare do I need and how do I access it? Do I have a chronic condition? Do I need regular medication? Can I afford private insurance or do I need assistance? Where's my nearest health center or the nearest specialty facility if I need one? Which hospital would I use in an emergency? These are the questions you need to be looking at. Although it is true that the system has real issues, the reality is that the Jamaican healthcare system offers several ways to access healthcare here. And today, I'm walking you through 10 of them. Top of the list is the Jamaica Public Hospital. We have several hospitals, public hospitals, and health centers across the island. Now, major hospitals will get overcrowded. Everybody knows this, but not every issue needs a major hospital. You can go to the clinics near you for routine care, screenings, chronic conditions, follow-ups. And one of the things Jamaica has is that almost every single parish has a health center, and there are some smaller communities that will have their own. Jamaica also has specialty public hospitals, and a lot of people don't even know they exist. We have the National Chest Hospital in Kingston, which treats respiratory conditions, tuberculosis, and lung disease. It's been doing that since 1940. The Bustamante Hospital for Children handles pediatric care. Victoria Jubilee focuses on maternity, and Sir John Golden does rehabilitation. The Bellevue Hospital handles mental health. These are all public facilities, so the same subsidized low cost model applies. All you need to do is find out where your nearest general health center is, which hospital serves your area, and whether a specialty facility fits your situation before you need any of them. So let's take a look at private healthcare. Private doctors, clinics, and hospitals will give you shorter waits and more privacy. The University Hospital of the West Indies, even though it is more available and accessible to the public, it is not entirely free, but it is not as expensive as other private hospitals. They handle specialized care for the most serious or complicated health issues in the country. There are also private specialty centers. The Heart Institute of the Caribbean is one. It focuses on cardiac care and has locations beyond Kingston, including Mandeville, Montego Bay, and Ocho Rios. The trade off with private care across the board is payment upfront. It is not free, even though you do have to make a deposit, I believe, at the University of the West Indies. But once they discharge you, you can enter into a payment plan. I don't know how many other places does this, so I'm not going to speak out of turn. All right. All right, before I move on to next on the list, I need to remind you that the University Hospital of the West Indies does have a private wing called the Tony Thwaites wing, and this is completely private and very expensive. So if you have your money, you can go up there, but if you need to go up there, you have to have up your dirty money. Anyway, moving on to private health insurance. Insurance can cover doctor visits, specialists, hospital treatment, and procedures depending on the policy. Make sure you check the fine print for what they won't cover and how long you have to wait to use it. And know that insurance doesn't make healthcare free. It manages the cost, that's true in Jamaica and everywhere else, but you will have to pay some money out of pocket. The NHF card is offered by the government of Jamaica for people who have chronic conditions, and this is something you may need to take a look at. As of March 2026, the National Health Fund covers 28 chronic conditions. That number grew from 24 after the NHF added heart failure, COPD, inflammatory bowel disease, and bladder cancer to the list. It's open to residents of any age, not just seniors. It also covers certain diagnostic tests. Things like PSA testing and echocardiograms are subsidized now too. JADEP, which is the Jamaica Drugs for the Elderly program, is available to everyone who is 60 years and older. It used to be a separate card apart from the NHF card, but I understand that they have now been merged. So what happens is that you can get the NHF card at any age, but at 60 years old, once you reach there, you now have access to the JADEP section of the program, which covers 10 chronic conditions, right? Another of the benefit you have with those 10 conditions is that you have you only have to pay a small dispensary fee at the pharmacy, roughly $40 per drug, capped around 240 if your prescription has 66 or more items. If medication is a big part of your monthly cost, this is one of the things you need to examine. All right. All right, so now the next option that is available for you to access medical health care in Jamaica is telehealth. And this is something I didn't even know existed. What this does is you're able to call in and you can do a phone call, a video, or whatever, but no office visit is needed. This is not a free service. Doctor on Call is Jamaica's original telemedicine platform. This was built by Telemedicine Limited and it connects patients with doctors, dentists, nurses, and other registered medical professionals through video consultation. You can get a diagnosis, prescription adjustments, and follow up care all without leaving home. The app itself is free to download, but you only pay for the actual consultation. And you can just go to whatever um apps, whichever phone you depend, whichever app service you have, it is there. It is an app available there. MDLink is another option, and it covers more than just Jamaica. It serves several Caribbean territories. Through MDLink, you can also do the same thing and get your lab test, whatever, handled digitally. Both platforms mean a rural resident or someone who simply cannot get into a clinic that week still has a way to reach a licensed doctor. The University Hospital of the West Indies, UWI, has also been expanding remote access to specialist care for people outside of Kingston. Number 8 on the list, another option. People sometimes overlook a medical or critical illness plan that is offered through organizations such as credit unions and banks. These plans can provide financial support if you are diagnosed with a serious illness such as cancer, a heart attack, or a stroke. Some plans may also include a major medical or hospital coverage. For example, some credit union plans combine health insurance, major medical, personal accident, and critical illness benefits. Some bank affiliated plans offer a lump sum payment after the diagnosis of a covered critical illness. The important thing is to check exactly what the plan covers because the benefits and conditions can vary significantly. And number 9, you have government assistance. This one needs care because there are actually 3 separate programs that exist here in Jamaica. And they don't all work the same way. The first one is the Compassionate Fund, which is run by the Ministry of Health with the NHF, and it's built for urgent, serious medical situations, life-threatening emergencies where time matters. There's no fixed grant amount. Each case gets reviewed individually by a selection committee. The Chase Fund Medical Assistance Program is different. It's built for long term illnesses, cancer, heart disease, kidney disease, that kind of ongoing treatment. Unlike the Compassionate Fund, Chase works with financial caps per applicant. Then there's the Care Fund, and this is the one that people get confused about. The Care Fund does not give money to individual. It funds community-based and faith-based organizations running local health projects. Things like mental health awareness, healthy aging programs, adolescent health initiatives. So if you are an individual with a medical need, the Compassionate Fund or Chase Fund are your options. If you are running or connected to a community organization, the Care Fund is worth a look. Know which one actually fits your situation before you count on it. And my last one on the list is emergency care. Now, all major hospitals run emergency departments. Some operate 24 hours. Emergency rooms treat the most serious cases first, everywhere in the world. So, a minor issue may mean a wait. Knowing your nearest facility before you're in a crisis is very important. All right. Now, I hope that the information provided here will help to ease your concerns about the health system in Jamaica. If it helped you in any way, I would love it if you would support the channel by hitting that subscribe button. Like the video, drop a comment, let me know. Have you learned anything new through this video? Share it with someone who is still on the fence about coming to Jamaica. And remember to hit the notification bell and select all so you get notified the next time I post. For more information on moving to Jamaica, you can check out my Moving to Jamaica playlist for more tips on moving to Jamaica. Thanks for watching. My name is Claudette, and I am your Jamaican Gypsy Granny. Walk good.